we are talking about RE1 or Varnimcabtagene Autoleucel. We have it approved for patients with relapsed refractory ALL older than 25 years. But in our country, in Spain, we have approval from the Spanish Medicines Agency to perform a compassionate use program for patients with B-cell lymphomas that have failed to respond to any conventional therapy. So we have been treating patients with relapsed refractory B-cell lymphomas that do not have any approved therapeutic option and are not don't fulfill the criteria for standard of care CAR T cells. So in this setting, we have been treating patients with RE1, with Varnimcabtagene Autoleucel, with in a wide variety of patients with lymphoma, including Richter's transformation, follicular lymphomas, other indolent lymphomas that are very refractory, but also aggressive lymphomas like diffuse large B-cell lymphoma, mantle cell lymphoma, Burkitt's lymphoma that don't have access to commercial CAR T cells for any reason. We have treated so far at least 45 patients, and we have seen that we were able to see at least an 80% of CRS, but only 4% of severe CRS and 2% of severe ICANS. And after this, we have seen an overall response rate of around 80%, but most importantly, a complete response rate of 64%. So focusing on these patients that do achieve complete remission, patients with very aggressive refractory disease, at least 4 prior treatment lines, we are able to see a plateau that makes people be free of relapse, around 40% at 3 years. And we've also seen a very nice absolute B-cell aplasia duration that goes into a plateau. So we believe that these patients that don't have CAR T cell treatment, conventional standard of care or commercial CAR T cell treatment, can be rescued with our point of care approach in a very selected group of patients.